Welcome. I'm Dick Deming. I'm medical director of Mercy One Cancer Center and the founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It's brought to you in part by funding from the Rosalie and Sherry Exline Ziegler Fund. Tonight, we're going to talk about massage therapy, and my guest is Marcus Walsh. Welcome, Marcus.
Thank you.
Thanks for being here. Marcus and I have known each other because Marcus is part of our integrative medicine program at the Mercy One Richard Deming Cancer Center. And I would have to say our massage therapy program is probably the most popular of all of our integrative medicines. Why do you think that would be?
I wonder.
So I have been the recipient of some of Marcus's work, and let's talk a little bit about you first. So where are you from? Where'd you grow up?
Grew up here in Iowa, here in Cedar Rapids.
Cedar Rapids. Which high school?
Kennedy.
What was your claim to fame in high school?
Oh, gosh. Being quiet and reading a lot, I guess.
Okay.
I was a singer. I was actually in show ensemble. But
so that's like show choir?
Show choir and show ensemble and choir, two separate things. Qualified for state, but I turned it down because I was terrified.
Really?
Yeah.
So what was your favorite production in high school?
I don't think I had one. There was the jazz performances were always my favorite.
Okay. And did you have to dance as well as sing?
There was some dancing. I was terrible at that.
Okay.
Yeah.
So when did you develop an interest in massage and body work, and what did that grow out of?
It's a good question. So I was actually in biopsychology and philosophy as an undergraduate.
So when you graduated from Cedar Rapids, where'd you go to college?
I went to Kirkwood, and then I went to the University of Iowa.
Okay.
And it was at Iowa where I started studying philosophy, looking for an understanding of the meaning of life. Big question. Found out philosophy was not the place to get the answer.
Really? Okay.
Yeah, just created more questions and some logic. And it was biopsychology that really started to answer some of those.
So describe what you mean by biopsychology.
Yeah, so behavioral neuroscience focuses on animal research for the most part, and it looks at ethology and ecological systems and animal relationships and neuroscience. Sometimes we'll do things in the lab, working with rats, put them through eye blink conditioning, Pavlovian, things like that, and start tracking the neurons from the essentially from the eyeball to the motor output, which would be in this case the eyelid and the eye blink. And so that was one of the labs that I worked at. It was John Freeman's lab, and I thought in those days that I was going to go on to graduate school and work with invertebrate species, but there was something about it that I just decided wasn't for me, and I went a different direction, and oddly it was massage therapy.
Okay. So I think of massage therapy. So I guess we think back to, Ben, when you're just in your family, you give your dad a shoulder rub or something like that.
Yeah.
And so I think most of us, if we have any, because I grew up in South Dakota in the 50s. I mean, there were no massage therapists. You didn't, but you'd give dad a back rub, and you might walk on each other's backs as kids in junior high or high school, and you sort of kind of knew what it was. But I don't know that I've ever really thought about the science of massage. So maybe describe what does it take? What is the training? Kind of what is the basic training for maybe 90% of massage therapists? And then we're going to go into some of the advanced training that you have into the science and sort of the body psychotherapy and the biopsychosocial dimension. But essentially, what would be the bare minimum requirements for somebody to say they're a massage therapist?
So the massage therapy foundation at Body Wisdom, where I went to school, is focused on therapeutic massage, There's deep tissue classes, myofascial, business classes, ethics, clinical work. Every student is required to do 100 hours of clinical work. If it hasn't changed, I graduated a long time ago, so they may have changed that. But for the most part, they are orienting the practitioner to get around 600 hours of hands-on exposure in classes, and that includes the business and ethics and all of that jazz.
Gotcha. And so do you get training in disease states, well, arthritis and muscular diseases, but also obviously you're working in a cancer center in that massage school before you got some specialty in oncology.
Mm-hmm.
Do you get much of a training in pathophysiology or disease states?
Not so much. There's a class on it, and it does address that, but it's not the emphasis. There's more of a focus really in the massage schools on spa work.
Mm-hmm.
And then if you want to go a different direction, you can specialize in Eastern modalities or possibly orthopedic work.
Mm-hmm.
So there is a sports massage section, and there is an oncology class. It's a rather short class, but it is available if folks want to do that. There's prenatal, there's manual lymphatic drainage and things like that as well.
And so your training was how many years in the massage
the
school?
Initial training was about a year and a half.
Okay.
So there is it doesn't follow the university model. So when you look at undergraduate degree, you can get an AA or a BA or a BS or something like that. And so far, there isn't a school that's doing something along those lines.
Mm-hmm.
So these are a little more towards business-oriented, licensure-oriented,
Mm-hmm.
Mentoring kinds of approaches too.
And then in the state of Iowa, is a massage therapist a licensed practice?
Yes.
Yes.
Yep.
And what does it take to get a license?
You have to pass a test. The test is called the MBLEX. And
is that a national test, or is it each state has its own?
I believe it's a national test.
Okay.
Yeah. And there's so you take that test. There's 100 questions or so. And once you do that, then you are approved to get your license, and you work with the state of Iowa to establish that.
Okay. And what was your very first job as a licensed massage therapist?
I worked at, and I still work at Massage Envy.
Okay.
And so it was one of those where I took a long break from where I started and graduated from the school to where I became licensed. And so I looked at this 14, 15-year break and thought, well, this is going to be a real rough way to explain what happened here. And I talked to Almed over at Body Wisdom. I talked with the state of Iowa. They're just like, yeah, it's fine. You just have to take the test, pass the test, and you can get your license. And
then does it require ongoing recertification, or hours of continuing education?
There are definitely hours of continuing education. I think they require that on the second year of your licensure. I don't pay attention to the number of hours because I love learning, and I already have somewhere around 100 hours of education on top of what I've been trained in. So,
and when in your career as a massage therapist did you know that you wanted to pursue more education and go into more of a therapeutic, and I might not be using the right words, and I don't mean to be demeaning, but I sort of think of, I probably the only time before in a medical setting, it was like I was on a vacation and it was a skiing vacation, and the hotel had a massage therapist, and you skied hard all day, and so you sort of gave yourself a luxury of a massage, but I wasn't going there to incorporate that as any part of a healing modality. It was just some achy muscles from a day of workout.
Right.
At what point did you know that you wanted to pursue something more integrated into the healing arts?
I'd say it was about a year into my role at Massage Envy. In those days, I was pretty dedicated to the deep tissue orthopedic approach. But I found that there was a barrier to longevity with that because the compressions can be a lot of strain on the fascia of my own body, and it creates range of motion limitations for myself. And there wasn't a clinical avenue that you could plug into very easily with that. In my mind, loves working with a clinical environment. And so Amanda Fry came to me, and I was in those days doing a lot of osteopathic work.
And Amanda's an oncology nurse, so for those who don't know.
Yep. And I had no idea what you were all doing downtown. I was just doing my thing at Massage Envy. And many people would come in with presenting symptoms of low back pain and shoulder pain. And what I discovered through the course of doing different massage or just simply doing massages was that most of that was correlated to gluteal attachments in the hip and pelvis. And so I had these large hands, and so I would be doing this positional release work on the glutes, and I could actually feel the quadratus lumborum relaxing as the glutes were relaxing. And so I drew the correlation to low back pain to pelvic dysfunction. And so I was releasing patterns of dysfunction pretty much all day long at Massage Envy, and it's kind of what I became known for. So she could not believe it was even possible that day. And she mentioned what you're doing downtown. And I think this was October before you opened. And she asked me if I would consider applying. And I said, of course, like that would be a dream for me to work in a clinical environment. So.
And then when did you get your the experience that you had at Mayo Clinic with medical massage?
Yeah, so that was this last year, and they have a hospital-based massage therapy class, and they told me that it's temporarily suspended, so I'm not sure what's going on with that. But the class was set up where we do 5 weeks of training remotely, and then we spend a week doing rounds at the various hospitals at the Mayo Clinic.
Mm-hmm. So you're working on inpatients that are in the hospital at the Mayo Clinic.
That's right.
And integrating massage work on the floors. Did you work in the cancer floor, or did they assign different students to orthopedics, neuro, cancer?
So Liza was the massage therapist that specializes in oncology, and we had to switch something around because I think I was running late 10 minutes on the first day, and it was Liza who I was scheduled with that day, and I didn't get a chance to work in oncology up there. So it was mostly organ transplants and ICU stuff.
Okay.
And so a little bit of lymphedema as well.
And was that a little intimidating to be in that environment where the docs are making rounds and nurses are making rounds, and you're trying to fit oncology, or you're trying to fit massage into a patient's schedule?
It really wasn't. It was one of those situations where it was like being at the school of Hogwarts. It was everybody highly organized, and the docs would do their rounds, but when they saw that we were there, they would say, let's get out of here. They're way more important than us. And they would send the massage therapy team in. And all the patients were grateful. It was absolutely incredible and shocking, because the inpatient care, you never really know what you're going to encounter.
What were some of the surprising things that you encountered? Because obviously you're used to an environment where people are coming to you,
right?
Walking in and driving there, walking in, coming to you. They might have some aches and pains, but they're otherwise healthy. And here you are in the hospital, maybe working on somebody who just had a liver transplant.
Yeah. The biggest difference is outpatient care is, like you said, folks are walking in, they're pretty much recovered from their surgeries or moving through a treatment, but they're able to manage it on their own. These individuals and patients were critically ill, some of them had days to live. Others were being released with congestive heart failure and 650 pounds, and then others were, or say for example, a heart and lung transplant 2 days before.
Mm-hmm.
And so learning how to hold space for the patients and to engage with a compassionate touch, that was one of the coolest things that we got to experience up there.
In an inpatient that is critically ill, I would imagine the conversation about what you're going to work on, what's your problem today, where do you hurt, is different. And do they direct you as to what to work on? Do the nurses direct you? Was that part of your learning experience from the staff massage therapist there? What you might work on an individual patient on a given day?
Typically what we do is we give the patient the choice. And so it's not so much the staff that chooses that, it's the patient that chooses what we work on. And the sessions on inpatient rounds are short. They're going to be usually 20 to 25 minutes long. And so to me, it felt like a blessing to be able to do that work. And the gratitude that the patients had was phenomenal. I mean, we would go in and we would do the work. In one instance, one of the patients said to the group, "Okay, you guys can leave. This guy's staying with me for the rest of the day." And it was a joke, but that was the kind of gratitude that he experienced. And when afterwards we would go and chart, and many of these patients would already have an order in for another massage.
And would typically family or friends stay in the room with the patient?
Oh yeah.
Because when you did your training up there was after COVID, so obviously they were having visitors again. And
Yep, definitely visitors and masks just to be safe, especially with specific patients with immunocompromised circumstances.
So let's jump forward to the work that you're now doing at the Cancer Center with patients. And some of the patients that you're working on are patients that are living with incurable cancer. Some are patients that have had their cancer treatment and are cancer-free. And
Yep.
some are just kind of getting started with their treatment. How does the setting of doing massage within the cancer center differ from doing the massage at your other place of work at Massage Envy?
So there's a couple different things. One of them is the awareness of our mortality of life is much more acute. I think that a lot of the clients in the spa trade are just kind of living in this space where they think they're going to be alive indefinitely, and so there is a deeper sense of purpose to what we're doing, and so I feel that every day, and I'm grateful for that. There's also, you need to be mindful of what the body is going through, especially with when you have lymph nodes removed, or if you're looking, or if a patient is in a situation where their immune system is going through a lot, whether that be something interior to them or through the chemotherapy or radiation therapy. And you have to be able to adjust your massage approach to suit that, to honor the do no harm philosophy, which is a very important one for me. The difference being that in the spa world and in the world of Massage Envy, there's tons of people who are just like, beat me up. You can't go deep enough, and so then it becomes one of those situations where I'm just like, I'm not really the therapist for you because I don't practice in that way. And so that's where the psychotherapy...
It's sort of the American way. Do it harder. Do it more.
Well, and so that's what I call the trauma-inducing approach to massage. And it's really a cultural thing here. And so my entire philosophy is trauma-informed and patient advocacy. And And so that's why I've studied different techniques, and I move away from pain and I move toward how can we retrain the nervous system to get in touch with the parts that we've dissociated from, so that we have to do deep tissue in order to feel like we're having an effective experience.
Mhm. And as you mentioned, many of the patients who will come might have had a breast removed or lymphedema, or have had radiation to the neck and have very stiff neck muscles,
Yeah.
or have had a tumor removed from the muscles of the leg. I'm just thinking of some of the patients that,
Yep.
and so the integrative approach is, you and I would go over, before you meet a patient for the very first time,
Right.
the cancer history. We might even look at their scans, talk about, first of all, are they cancer free, or are they living with cancer? Where was the cancer? What was the surgery? What was the treatment?
Yeah.
Are we already recovered from the surgery? Are we still recovering? So that you know what they're going through, what the status of their cancer is, and what lingering physical, psychosocial, philosophical, spiritual issues they might be facing even before you meet them for the first time.
Right. Yep. The intake is a really important feature of what we do. And it is something that we do. We have a little bit of history on the patients or the clients over at Massage NB through the iPads that we use, but it's definitely not as detailed, and it's certainly not used in the particular way that we do it at the cancer center.
Okay. Talk a bit about some of the experiences that you've had in helping patients at the cancer center.
Okay. So there's sometimes, most of the time, patients don't have a lot of experience with massage. That's one of the differences between the folks at Massage NB and the folks at the cancer center. It's more common for a patient to come in and say, I've never had a massage, or maybe I have, but it's been one or two. In one instance, a patient came in, and before we even began, she says, this is not going to work. And I think, wow, this is awkward. And so I gave her the freedom to cancel it. I said, if you don't want to experience this, that's totally fine. There's nothing that says you have to do this. And I said, by the way, why don't you think it's going to work? I'm just curious. Because most of the time patients are like, oh my God, I can't wait. This is the one appointment that I don't get poked and prodded. It's going to be great. And so she's just like, well, I had a massage before and it was excruciating. And I was in pain for 6 to 7 days after. And I said, well, I'm really sorry that experience happened to you. I said, I'm just for the record, I'm very highly trained and I'm trauma informed, so I promise not to cause any pain. And if I do, I want you to tell me right away so we can adjust so that you're not experiencing pain. And so the session began, and needless to say, I was a little nervous. And she was in her 80s, and she got on the table, and we were beginning, and I was doing a light kind of what the Mayo Clinic would call a level 2 pressure, and just very nurturing. And about 10 minutes into it, she was extremely quiet the whole time, so that makes me even more nervous. And I asked her, is everything going okay? And she says, it's wonderful. And so I said, good. And I let her enjoy that silence and just be with that wonderfulness for the rest of the session. And
yeah, so as you describe, a woman in her 80s, I think of also, as we bring people here to the Mercy One Health and Fitness Center and get engaged, not everyone grows up with this mentality of going to the gym and knowing their way around the gym and the locker room and everything. And it can be pretty intimidating for someone in their 80s or 90s to be in a space that is new and uncomfortable and not sure what's the dynamics of even getting up on the table.
Yeah.
I'm sure it's a lot different than, 30 30-year-old bopping into the spot for a
Very different.
massage and that they've had once a week for a year. Um, what are some of the other experiences that you can remember of individuals who'd never had a massage before that had medical issues where you had to sort of negotiate, navigate that whole process,
Yep.
even getting on the table? I'm sure you have to accommodate
Absolutely.
some
In fact,
patients.
the table, I had the table set at a higher position until I had a patient who couldn't get on it. And it wasn't very high, but I thought it was low enough. So I lowered it and it stays low. And I even have patients who ask me, is that table too low for your back? And I said, it doesn't matter. It's at the level where everyone can get on it. And that's what matters to me.
Mm-hmm.
And so it's made me adapt to a different style where I'm using the stool and swiveling around on the side of the table to get access to the patients, because I want every patient to feel like they have access and they're not presented with barriers.
And again, this is an integrated approach with in a medical setting. So I can imagine in a spa setting, if a woman just had a mastectomy and has some lymphedema, and you go to a spa setting, and that, depending on the experience of the massage therapist, they may go, well, we're not going to work on that, but we'll work on sort of the normal parts of your body.
Mm-hmm.
Whereas in the cancer center, that's part of referring the patient, is to have you work on
Right.
those parts of the body that might have experienced surgery and are having some either surgical, radiation side effects, or peripheral neuropathy as chemotherapy side effects.
That's right. Yeah, we don't. The spa world, if somebody approached a patient and said we work on the normal parts, that's marginalizing parts of their body.
Yeah,
And
I
we
realized, even if I said that
we would never do that in integrative medicine. We're trained to accept them for their whole body and mind. And we're trained to work. If we're not trained to work in certain areas, then we establish the psychoeducation or the patient advocacy to say, listen, this is outside of our scope, but we can refer you to a specialist who will take care of that for you. And that's another feature of the training, is that we know where we stand and how we operate, and we know our ethical obligations and responsibilities to the patient.
And what type of conversations do you have with the patients, either before, during, or after your body work?
So before I listen, I sit and I listen to them just share. And I look to see, for example, if there's like how they feel about what they're sharing and where they're at emotionally with what they're sharing, to get a sense of how I'm going to approach the massage itself. Because there's some people who are like, oh yeah, I'm fine. I'm 6 years out from, I'm officially in survivorship mode. Everything has been looking great. I'm running 5Ks 3 times a week or something along these lines. And they really want to get back into deep tissue, and they're upbeat and kind of bubbly. And I recognize that person can deal with a more a level 3, level 4 pressure, get more into neuromuscular therapy and things like that. But if someone comes in and says, I'm fine, I'm the healthiest I've ever been, and then you start to see them getting a little shaky, and then you start to see them getting a little emotional and panicky, and they're just like, actually, I'm pretty terrified right now. And they start to shift their narrative a bit, then you know that you're going to go into a more nurturing approach, using a lighter touch, and always a very connected and very supportive, slower kind of movement, because this is going to help increase their oxytocin. It's going to give them a sense of connection with me. It's going to give them a sense of connection with their body, and it's going to reduce their anxiety.
And a lot of that assessment happens before, or is it happen as you're sensing what they're doing while you start the the actual body work.
That's happening while we're just sitting there.
Mhm.
And so I'll just be sitting on my stool. They'll be on a chair and they'll talk. And sometimes they want to talk, and I'll give them that space to talk. And they'll even say to me, "Oh my gosh, I'm wasting all of this time." I'm like, "This isn't a waste of time at all. Like, this is your hour in your session to do what you need to do." And so taking 25 minutes to talk about your needs is an important part of this process. And then we'll get into the massage, and we'll do a very nurturing massage for about 20 minutes, 25 minutes. And they'll feel seen, and they'll have a connection, and they'll walk away feeling usually pretty good.
Mhm.
Most patients I see are really kind of blown away by that first experience.
So I think that there are some people apprehensive because they're not sure what state of undress they're supposed to be in when they get a massage. And I think some maybe decline a massage thinking, oh my gosh, I'm going to have to go and get naked in front of somebody I don't know. What's your conversation with them about what state of disrobing
Yep.
and position on the table? And then I'm thinking in particular of maybe someone who had a surgery and has an altered anatomy.
Yep.
And are they some not wanting to reveal that, to disrobe? What's been your experience?
So there's every possible illustration that comes in. The patient will determine all of that. And I just simply tell them, this is your hour. You dress down to whatever comfort level suits you, which could mean I specifically also give them this leaving your shoes and all of your clothes on. And I work in that way too.
Mm-hmm.
And it could also mean just dressing down to nude. And there are some people who really start just taking their disrobing in front of me, and I'm just like, I'm going to step out for a second. And they're just like, I've been around doctors that are doing this all the time. It doesn't matter to me anymore. And so I'm just like, yeah, but it still matters to me. It's just a boundary. And so we're going to just keep that boundary, and I'll be right back, and I'll knock to let you know I'm coming in. But there's plenty of people that get on the table with shoes, leave shoes on, everything.
Mm-hmm.
And it happens on a very regular basis, and I honor that.
Mm-hmm.
And they still get an effective massage. You know, that's the other thing, is that clothing is not a barrier to effective massage therapy. I had a massage therapist who was in, and they said, I don't really think there's a way you can work through clothes. And by the end of it, they said, I cannot believe how effective that was despite leaving the clothes on. And that was a case of reconstructive surgery where they didn't want to expose themselves. And I totally honor that.
Mm-hmm. Let's shift gears just a little and talk about the various styles of massage that that you do and that you've learned, and how they differ, and theoretically what they're supposed to do. Anything from light touch to rolfing, or other terms that I probably don't even know.
Yeah. So light touch is falls into the therapeutic kind of feathering, quick movements across the skin, not really getting a lot of deep compression into the muscle tissue. And like you said, rolfing is much more restructuring the fascia, crushing the muscle. Those who have experienced rolfing liken it to torture. It was developed in the 70s, I believe, by Ida Rolf, and it's effective.
A very strong German woman.
It's a very, very deep style of restructuring of the musculature. But since then, there have been a lot of techniques that have come along that the osteopathic physicians have been developing, particularly in Canada and Europe, but it's catching on a little more here in the US as well. So you see strain, counter strain, or positional release, or myofascial release, and muscle energy techniques, and these are and visceral manipulation is another one that's very subtle. And I was exposed to cranial sacral by a doctor, Dr. Musgrave, after I had a really severe and painful contraction of my quadratus muscles in my low back. And in those days, I didn't really have any recourse to solve that problem. I wasn't a massage therapist at that time. I was walking with walking sticks to help stabilize me. And he came in, or I came into his office, and he's doing these extremely light, almost like pulsing like things on my torso and also on my back. And I just thought, this is ridiculous. This is a total waste of my time. But afterwards, I could actually walk out of there and changed muscle tone. And so I asked him if he would be willing to teach massage therapists, and he said he could only teach students at DMU. And so
this was a osteopathic physician, and
Yeah,
this
it
was
was a-
part of osteopathic
manual manipulation, yeah. And so that set me on a course to start collecting books and doing a self-study in these osteopathic techniques. And it was in the course of this work where I picked up neuromuscular therapy and positional release and something called dermoneuromodulation, which is a physical therapy modality that is taught by Diane Jacobs in Canada. She's now retired, but the beauty of the massage therapy license is I get to do all of the touch therapies. It's just a matter of if it's relevant or not. And so as I was developing all of these, I was moving away from these structural muscle-based systems and looking at how can we embrace fascia from a perspective that's more like the nervous system, which is to say it is adapting to the environment and creating tension, force, kinetic chains basically across the fascial sheathing, which transcends the musculature, but also is informed by the nervous system. So it led me into this space of using techniques that were much more gentle, much more oriented towards a clinical curiosity and an interaction, a relationship with the patient, as opposed to me just fixing the patient.
Mm-hmm.
And so,
and how much do you alter what you're doing based on what you're feeling or what the patient is demonstrating in terms of either tensing up or oohing or eyeing, or just giving you either positive or negative feedback for what they're experiencing?
I'm always looking for cues that will indicate that the patient isn't communicating their level of pain. Some patients don't like to communicate that, but you can see it in the little micro expressions in their face, or you can feel it in the way a muscle reacts to the pressure. Usually the muscle is going to push back against you if it feels like something is going to cause it harm. It's got a reflex in it that's going to push or bounce whatever the action is away from the body. So as a therapist, you can notice that, and I've developed palpation skills now where I'll come up to a barrier on the tension pattern, and I'll back away from it, and I'll say, as my shiatsu instructor would say hello to the muscle, and give it the space to wait for it to respond. Because if you do that, the muscle will start to relax. And it was actually in yoga training that I learned about this, in particular with regards to light movements, inflection and extension of different joints evoked an energetic shift in the fascia. And so in those days, I wasn't really sure how that would translate to massage therapy, but then I developed the palpation skills to integrate that just by holding space. And I think the Mayo Clinic training was really what helped to inform me on the lighter side of massage,
Hmm.
because that energetic, lighter compression can do wonders. And you're also working with multiple systems at that point. So the skin itself is evolved from the ectoderm, which is where the nervous system plays in. And you have all these nociceptors and other proprioceptors and interoceptors working in concert in the body to inform the central nervous system. In addition to that, you have the lymphatic system just underneath that. You have the circulatory system. And so you can affect quite a lot of change with light touch that doesn't have to be this torture fest of changing the musculature. And that's where the biopsychosocial model plays in a little more to this.
And in your, I know you're very interested in the body psychotherapy and how working with the physical body can affect emotions. Is there a particular theory or type of body work you would use? For example, you're not a psychiatrist, you're a massage therapist, but you can, as a human being with emotional intelligence and in a conversation with a patient, maybe sense whether they are having a good day. They seem to be joyful and kind of excited about what they're experiencing, as opposed to appear down, maybe even a bit tearful. And you want your body work to not only deal with whatever might be happening with the fascia and the muscles and the nerves, but that you want to interact in a way that will bring them a sense of peace or calm or a better psychological state. How do you incorporate that? How might you do massage on someone who is sad and tearful when they come into your room versus someone who is, joyful and exuberant?
Yeah. A lot of that gets down to do no harm, right? So the goal in a case where someone's dysregulated and feeling either angry, anxious, sad, they're usually going to experience a lighter touch, because the lighter touch is going to regulate them, and it's going to give them the space to feel the connection, to reconnect with their body, to reconnect with their community. And it's anyone who's experiencing some sort of negative affect, we're not there to fix it. We're not there to change anything. We're really holding space and allowing their body to do what it does naturally, to reconnect with those parts that will allow them to feel safe. And so that really just comes down to being compassionate and using a lighter touch, making sure that you hold awareness to always have contact, full palm contact, and you're not like poking and prodding and doing these like kind of surgical finger things. You're doing a whole palm connection. And typically you would try to use a salve or a balm of some sort to give a little more glide to the experience. That would help too. Mm-hmm. And if you can't do that, if their clothes are on, then you can effectively glide along the clothes, because clothes are easy to just rub against and just allow them to, you still have full palm contact and you're moving slowly, because that slowness is going to create a deep sense of calm and bringing them back into their body. Anytime you can bring someone back into their body in that calm way, it's magic for re-regulating their nervous system.
To what extent is the environment, meaning the room, the lighting, the colors, the music, any aromas, any balms or salves or oils? How do you choose what the environment's going to be and what you're going to use for either oils or salves.
So I have a number of different oils and salves, and I always give them the choice. I call it the sniff test. It's really complicated. They smell it, and they determine whether they like it or not. And so I use salves that are made from ingredients that are helping the skin heal. And it can go a little deeper into also nurturing like if they have bruises or something, it'll help that as well. And so I try to make sure that every lotion or oil is oriented towards the therapeutic goal, right? The lighting is always off in my room. I don't like the overhead lighting, and I feel like it's generally speaking, I've never had anybody say I really want those fluorescent lights on.
Right.
So
and there's enough natural light in our massage rooms, and you're not doing it at nighttime. It's
right,
during the daytime. So
so we have the screens down, diffused lights coming in, and I don't necessarily use aromatherapy yet, but the salves do have some flower essences and things like that in them. So there is that smell, and then I have a little speaker, and I play relaxing music.
Mm-hmm.
So light therapy would be pretty cool, but we're not there yet. So we'll just have to press.
So in the perfect world, what sort of lighting options would you like in a massage room?
Well, so at the Tom Harkin Institute, they have a room dedicated to
Where is the Tom Harkin Institute?
that. So that's over on Drake campus.
Oh, you mean the Harkin? Yes, Tom and Ruth. I see. I was thinking. Yes, I do know the Harkin Institute. I was thinking a place where you went to get a massage.
Oh, no.
Tom has a spa. No, I'm sorry. I didn't mean to interrupt. Yes, and it is the Tom and Ruth.
Oh,
Harkin
I'm sorry.
Institute. So, but
My
anyway,
apology
at
for
the
that.
Harkin Institute, which is a beautifully designed building to be as accessible as possible.
It's
So
beautiful.
I didn't mean to interrupt. So what
No, that's
what
good.
were you going to say about the lighting in the Harkin Institute?
So there's a room where you can go when you're feeling overwhelmed or you're having just one of those moments, and it's lights out or windows shuttered, and there's lights that are rotating, and you can choose which colors, basically which wavelength you want, and you can just sit in there for 10-15 minutes and just
Mm-hmm.
and so I mean I don't know how much that costs, but it would be.
But you would like that to have some lighting options that are either different colors or infrared or ultraviolet or
Right. So I have a far infrared and infrared and red light medical grade therapy tool that would be something we could offer if we wanted to.
Mhm.
It heals, it accelerates healing in the skin. It goes deeper into the body and heals and boosts the immune system. So the story goes with it. So that would probably be the most realistic medically oriented light therapy to use. But if we're looking just on the biopsychosocial model, really any color spectrum that would benefit the patient would be suitable.
Mhm.
Typically anything that's going to cause them to start to feel calm.
So my experience, and again, kind of sticking with this theme of body psychotherapy or the biopsychosocial, if I get a massage, so let's say I'm experiencing sciatica or I've got a hamstring or that I tweaked, and I come away not with that necessarily sense that the physical has been fixed, but I come away with this sense of just overwhelming calm and peace of mind that it's like, boy, if I could feel like this all the time, this the world would be great. And it's similar to, I think, even like a good conversation you have with a friend that you sit for an hour and you're not necessarily touching, but there's something about the way that this physical interaction affects my psyche, my emotions, I'm not even sure what's the right phrase that describes the sense of calm.
Mm-hmm. You're asking me what are my thoughts on that?
Yeah,
So
you can make up a question.
so
Do you see that? Do people comment on that?
all
your,
the
your
time,
clients all the
all
time.
the time. So I'm going to go back in time a little bit. Back in the day when I was first trained in massage, fresh out of school in neuroscience, everything was mechanistic, right? And everything was orthopedic, and I was fixing people, and I was doing structural work, and it was awesome because that's how we do things. And therapeutic massage, that's kind of just spa stuff. And I had a bias. I had an unfair bias, and I even told a patient today, if my today self could talk to the old self, I'd be like, you're an idiot, because it's not all about orthopedic. It is holistic. It's really humans existing in an ecological space and taking the time to touch, to regulate the nervous system so that you can experience that calm that you described so beautifully is precious and priceless in the state of society today, with everything that we're doing. And as we engage in our environment, the stressors that are out there, we're constantly getting hit with stressors. And massage therapy, especially this style, is so powerful in reducing stress and eliminating certain parts of that. And I fold that into the learning and memory model that I picked up in undergraduate, and I look at it from the perspective of how can we basically titrate these stress reduction therapy sessions into the nervous system so the person can have resolution of pain patterns, a sense of calm, increased range of motion, deeper sense of connectivity with their family or with us at the center. Usually they're just like, I feel great. When do I come back? Like, how soon should I come back? I'm just like, well, that's really up to you. But the clinician in me would say, if you start experiencing pain again, get in here, because the sooner we can treat that pain, the longer we can stretch that resolution window. You might have one massage and you're pain-free for 2 weeks, which for some folks is a dream come true. And then you come back, you have another massage at that 2-week window, and now you're at 3 weeks, and then 4. And now you can come once a month like a normal, what the industry would call a normal cycle of massage sessions.
So what you've been describing is obviously a human being working with another human being. And I know the power of human beings working with human beings. Is it possible to do self-massage? You don't have the two human beings.
Mm-hmm.
And of course you have some physical limitations, but with gizmos and gadgets and rollers and knobs that you dig into your muscle. I mean, is there such a thing as self-massage that can give you anywhere near the sense of peace and calm that happens when another human being is working on you? And do you ever think a robot? So now you don't have a human being, you've got a robot. And I'm just thinking that no matter how well programmed those hands are, it's not a human being. So do you think, number one, there are self-massage techniques that can bring you results? And second, are you going to be, relegated to the trash heap when they develop the AI robot that can massage?
Well, there's definitely techniques that you can use to treat yourself. Tennis balls and golf balls are really helpful for that purpose. There's these foam rollers that people use to some effect, but but you still need to have at least some awareness of how to approach the release. And that's where folks will struggle with they may try it and they're just like, I just can't do it like you do it. And so then that would be something where we would try to educate them, and like a physical therapist would give them homework to do, and they could do that for themselves. And there's neat little things for the feet that are marketed as reflexology rollers and things of the sort, and they feel wonderful. And it's super easy. You just take your shoes off and you just rub your feet back and forth on them, and that feels great. So I think that would be those are some of the tools. The Theracane that you referred to with the hook and getting into the back really does help a lot. It's one of those things that can be, your pain levels better than anyone else, and so you can just work with that. And once again, that would be something where the therapist would try to educate the patient on the different muscles. In the case of a cancer patient, you also want to be very mindful of what we're trained, how we're trained in oncology massage and hospital-based massage, to make sure they're not hurting themselves, because this is something that they don't know, that what we know about lymphedema, but they also could be coming at this from a perspective of the modern culture looks at massage as you got to dig in there and get that. But you do that to a spot that is in the quadrant of lymph node removal, you're putting yourself at risk for lymphedema, which means you're causing yourself to have to visit another practitioner to handle the fluid flow, which means your week has just gotten busier with one more medical visit week after week, because lymphedema is a lifelong risk. So,
where do you see your career going? Oh my gosh, we're almost out of time. This is going to be the last question.
All right. It went fast. My career, I want to stay in clinical care.
Okay.
And I want to deepen my knowledge of scar tissue remediation and pain management. So those are my goals. And I want to integrate that with movement therapy and psychotherapy.
So I think I'm hearing you say you have more professional fulfillment working in this medical model than you do in a spa.
I love the medical model. Yeah.
Let's open up for some quick questions. Fred.
I've got a question. You talk about muscular and fascia. What about if it's joint pain? Does massage and joint pain, and I don't know what it could be caused by, let's say, arthritis or something. Is massage effective or helpful in that?
Well, we wouldn't be treating the joint itself. So pain is somewhat of an idiopathic or an unknown currently in medicine, and we don't. There's certainly specialists that will use steroids and other kinds of treatments to eliminate pain, but massage therapy would address that by working with the scope of practice of the therapist, with muscle, with the skin and the fascia. And oftentimes those nociceptors that are involved in the soft tissue work will resolve some of that pain. So if it's a strictly inflammatory or arthritic thing, the odds are pretty low that we're going to be able to treat that. But from our experience with some of the patients in pain like that, you do see a reduction in the perception of it.
One more question. Angelina.
Yes, I had the experience when I got a gift certificate to a massage therapist, but I just got diagnosed with cancer. And so when I told the massage therapist, she was scared to death. She had me hold a pillow and she goes, I'll treat you like a pregnant woman, so I won't touch it. I went, that it was non-effective, this whole massage. I felt I should have gave that certificate to someone else. But do you do, like with someone who's had lumpectomy like myself, when you have them laying on face down, do you put something here so they're not laying completely down? Because that's kind of hard.
Yeah, so in that case, I would give the patient the freedom to choose what position is most comfortable. It's very important that the patient is in control of every feature of the session. And so I would never force someone into a position that would cause them either harm or the perception of harm or the fear of something bad happening. And I'm sorry that happened to you, because there is plenty of people that don't have the education to do proper massage, but oncology patients should be able to experience all forms of massage therapy with caveats towards protecting them and keeping them safe.
Okay, one last question.
Okay. Would you recommend cupping or scraping for someone with lymphedema?
Ooh. That's a tough question. I would say it's contraindicated for someone with a risk of lymphedema in the quadrant where the lymph nodes are removed. What was the second? Scraping is that particular technique, unless it's in the hands of somebody that's working very delicately, it can be quite intense, and it can create a trauma pattern that creates inflammation and fluid collection. Cupping is a little more individual, and so probably, I mean, some people would argue that you can do it effectively in the quadrant where the lymphedema risk is occurring. I would be a little more cautious, and I would use cupping in other quadrants to stimulate lymph flow in the quadrants that already have effective drainage, and to promote the drainage from the region that has the lymph nodes removed to drift into those quadrants.
Well, thank you, Marcus. And if anyone out there wants to experience Marcus, please come to our cancer center. And we have an endowment that allows cancer patients, whether they're just diagnosed in the middle of treatment, having curable cancer, or cancer survivors, to experience the medical massage from Marcus and his colleague Kirsten at our center. So I welcome you to that. Thanks, Marcus, for being with us. And thanks all of you for attending. If you know someone that would benefit by watching or listening to this podcast, it will be available on demand tomorrow at the Above and Beyond Cancer YouTube channel or the Mercy One Cancer Center website. And I hope you'll join us again next week. Thanks, everyone.